Welcome to Unit 7, Principles of Clean Air Advocacy. By the end of this unit, you will describe the key role of health workers for clean air advocacy. Healthcare practitioners are mainly preoccupied with the clinical care of their patients. However, their role also extends beyond the clinic to involve their patients' family and their communities, either urban or rural, to protect and promote people's health and well-being. It can be challenging working out which type of health and preventive messages and measures to provide to individuals and the community with regards to air pollution, but health workers and caregivers have a big role to play. There are some key principles to remember when acting as an advocate. The first principle is to use the evidence base. Health professionals need to respect the evidence base and not use any unverified data or information. The evidence base is derived from scientific literature or other credible sources, such as institutional and intergovernmental reports, including WHO websites, data, and publications. If available, it is important also to consider local data on exposure to air pollution and morbidity and mortality data. WHO has also developed tools that can be used to quantify the health impacts of air pollution in a given population to guide policy interventions, especially interesting for public health professionals. We will look at these in more detail at the end of this module. The next principle is to maintain credibility. Health workers have significant credibility and are seen as a trusted source of information, often more so than government and other scientists. This respect is dependent on arguments remaining carefully evidence-based. In thinking about possible ways to be an advocate, it is important to seek and clearly define effective interventions. For example, what policy interventions would have a significant positive health impact? What are the key policy issues related to improving the air quality? Is there a role for health evidence to support policy planning and implementation, for example in rural and urban transportation, energy, waste, agriculture, or household air pollution? When planning advocacy or community interventions, it is important to first understand who else might be involved. For example, are public health professionals working in the area? Could their work be supported? Are there researchers in this area? Their data would be useful to guide work. Are there non-governmental organizations active in air pollution? If they are reliable and evidence-based, there might be an opportunity to work with them. Can health workers act outside the clinic as community advocates? Health workers cannot act alone, so it is important to seek out other individuals or groups, including experts or practitioners in other disciplines, that would complement or support interventions. Such co-advocates must be credible and hold evidence-based views. As an example of this, healthcare workers are not experts on transportations, but as a team they can contribute evidence regarding the health impacts of transportation-related air pollution. You have now completed Unit 7. In the next unit, we will look at some of the ways health workers can advocate for clean air.